Okay, I want to welcome everyone to Feminist Public Policy, Centering the Needs of Women, of All Women, our Cocktails and Conversations event, a part of the Women's Fund of Omaha 30 Days of Action. My name is Tiffany Seibert-Yakel. My pronouns are she, her, hers, and I am Research and Policy Director at the Women's Fund of Omaha. We're joined today by almost 100 participants and 4 incredible panelists, and I am beyond honored to share a computer screen with these women. We are having this conversation because the pandemic has amplified all the ways in which our public systems are failing us. We have the opportunity now to pause, reflect, and rethink about these inequities and what work needs to be done in our communities. Rather than rushing to rebuild the status quo, we have an opportunity and an obligation to build bridges to better and brighter futures. This work must center the needs of those most impacted by gender-based violence, oppression, and discrimination, including Black, Indigenous women of color, trans women, non-binary, and gender non-conforming folks. Too often, the feminist movement has been focused on advancing the interests of those women most privileged in our society. And as feminists, we must refocus the movement to center those most marginalized, especially during a time of crisis like COVID, and ensure that all Nebraskans have the ability to attain economic stability and ultimately reach their full potential. Our goal today is to develop a deeper understanding of a few policy issues that are foundational to economic stability and equity for all: housing, food security, childcare, and reproductive justice. It's our hope that this conversation will better inform our advocacy on behalf of all women and those most impacted by gender-based oppression. So if that sounds good, a few housekeeping items and we'll dive into the panel. All participants will be on mute. We will begin with allowing or asking the panelists to give a brief introduction of themselves. I will ask a few prepared questions, and then we will take up audience Q&A. For audience Q&A, we'd ask you to submit your questions through the Q&A function on Zoom. You can pose your questions throughout the discussion. Kelsey Waldron, Policy and Research Associate at the Women's Fund, will be monitoring that Q&A and will elevate questions for the panelists during the audience Q&A section. This event will be recorded and made available on our website after the session. So with that, I would like to ask our brilliant panelists to introduce themselves. If you could start, give your name, your pronouns, and give us a couple minutes about yourselves that help give us foundation and context for the conversation we're about to have today. I will start with Brenda, then we'll go to Nancy, then we'll go to Julia, then we'll go to Dr. Aaron. So with that, Brenda, would you kick us off?
Okay, thank you very much, Tiffany. I hope everyone can hear me. My name is Brenda Council. My pronouns are she, her, hers. I've had the privilege of serving the residents of North Omaha in various elective capacities over the years. I served on the Omaha Board of Education for 13 years. I served on the Omaha City Council for a term, and I served in the Nebraska legislature for 1 term. And during all of my public service, my efforts have been directed at improving the conditions that people in North Omaha are living in, and working to address education, health, economics throughout this process. I was fortunate to be hired by the Women's Fund in 2014 to lead their adolescent health project, and it fits squarely within the work I was doing at the time, because my work showed me that a lot of the issues impacting residents of North Omaha had to do with the fact that they were experiencing unintended pregnancies, and these unintended pregnancies were resulting in too many children living in poverty. So with that, that's why I'm here today. I had the privilege of working for the Women's Fund from 2014 to 2019.
Nancy?
Hello, my name is Nancy Williams. I am one of the co-founders for No More Empty Pots, and I serve as the president and CEO. Sorry, my landline decided to start ringing right now. I apologize for that. It's probably an election call. But I will share that I am here to talk about food security. I grew up the oldest of 6 kids in rural Louisiana, and we grew most of the food that we ate, and I took that passion for food and went to college and parlayed it into more formal study. But it is my history of knowing about food and eating good food growing up that I felt passionate about having the same level of good food access in the community where I live now, which is Omaha. We've lived in this neighborhood for 20 years and raised 4 kids here. And I wanted other families to have the same level of access to good food that I could get myself, knowing what it was, where to find it. And I didn't feel like that we should only have access to good food if we knew where to go and we had the transportation to get there. So part of my charge in being a part of No More Empty Pots is making sure that each of our neighbors has access to good food wherever they choose to live, and that they can do that autonomously without worrying about whether they can get that food or not for themselves and their families.
Thanks, Nancy. Can we move on to Julia?
Thanks, Tiffany, and thanks for inviting me to be on this panel. It's such an honor to be with these lovely and smart and intelligent women. I am the policy coordinator. My name is Julia Isaacset. I am the policy coordinator for economic stability and health at Voices for Children in Nebraska. My pronouns are she and her. Voices for Children is a public policy organization that works to build pathways to opportunities for all kids in Nebraska. And we do that through policy, through research, and through community engagement. And we do that by working in 4 areas of policy: economic stability and healthcare access, which is my half of the policy house, and then the other half has to do with kids in the courts. So kids who are in our child welfare system for abuse or neglect, and kids who are in our juvenile justice system. And childcare is one of the biggest issues that we focus on when it comes to economic justice, because it is oftentimes the largest expense for households with children, especially young children. And that is, if we can address the affordability for lower income families, we know that we can also change what we see in terms of child poverty, which is that children are the age group in our state that are most likely to be living in poverty. And the only age group that is more likely to be living in poverty are young children under age 6. So this is a really key issue for us.
Erin?
Hi, like Julia said, I'm thrilled and honored to be sharing a screen with all of you. I love Nancy Williams so much, and Brenda Council is a personal hero, and Julia with your headphones, I love it so much. So Dr. Erin Feitstinger, my pronouns are she, her, hers. I'm the Director of Policy and Advocacy at Together, which is on 24th and Leavenworth here in Omaha. I'm here to talk about housing, and that's presumably because we really have not had a sustained conversation about housing and housing policy in this state or in this city for a really long time. So anyway, I don't know. My bio's in the in the chat, and I'm really bad at introducing myself and talking about myself. So really happy to be here and thrilled to be talking with all of you.
Thank you all for introducing yourselves. And for participants, just so you can see, there's a link in the chat if you want to check out everyone's full bios. We have them listed on the webpage there for the link with the link. So Erin, let's dive in with housing and let's start that sustained conversation. Tell us about the work you do at Together to promote housing stability, support housing stability?
Sure. So together our mission is to prevent and end homelessness, and we do that primarily in 4 ways. One is through our food pantry, which I was talking about before this all started. And we are, I'm fairly certain, I can say comfortably at this point, serving probably the most people in Nebraska through our food pantry. We crossed the 100,000 mark last Monday, and that's just people served since March 16th. And just to give you a scope of kind of what that means, last year, in all of 2019, we had a record-breaking year. And Nancy, I don't want to step on your toes on food security, sorry. But last year in all of 2019, we served 42,000 people. So that need is pretty great. The second way we do this is through crisis engagement services, a program that's also grown since the onset of the pandemic. Basically, this is trying to divert people from homelessness. So if we can intervene now in preventing someone from going to the shelter or losing their housing by doing something like covering rent for a month, or maybe groceries for a little bit, or utilities, and this will keep you in your housing, then that's what we're gonna do. And we know that it costs less for us to intervene now and prevent you from becoming homeless than it does for us to pull someone out of homelessness. Which brings me to the third way we prevent and end homelessness, which is through our rapid rehousing program, which helps people who are in the shelter or who are living on the street. And we give them a case manager that provides intensive case management for really as long as you need in order to get out of homelessness and find and maintain your housing and find that housing stability. And advocacy, which is what I do, is our newest part. And the idea here was that all of these programs that we run that are successful will be far more effective at shortening the line of people who need us when we have policies, good, smart, sustainable policies that support the people who we serve. And I think they also just wanted me to stop bothering them so much about the legislature. So those are kind of the ways that we try to build housing stability together. And I'm really proud to be part of the team. And I think we do really amazing work. So, and we just bought the Leavenworth Cafe, as many of you have probably read.
So, Erin, the issue of housing is foundational, quite literally, to economic stability, but also really complex and multifaceted. Can you talk to us about some of the policy work or the systems that you are working to change to essentially shorten the line of people who need you?
Yeah. So one thing is when we talk about the housing crisis, I want to make sure that we're talking about it as something that's far more than just homelessness, than people who are living on the streets or in the shelter, which is how we've typically thought of homelessness and housing. It's like you either have a house or you're homeless. And there's a whole spectrum of issues in between there that need to be addressed. So for me, it means, housing and stability. Whether you're paying too much of your income to housing out of necessity, you have fewer options for safe, affordable housing because you're lower income, whether or not you're couch surfing or you're doubling up with family or friends, or you're in any kind of temporary living situation. All of these things encompass the spectrum when we're talking and thinking about the housing crisis. So for me, as a housing advocate, I think about it as I fight for anyone who is worried about losing their housing because of forces outside their control. And by outside their control, I mean that the reason that we have a housing crisis, the reason we have housing instability, the reason we have a lack of safe and affordable housing in our community is because of bad public policy and elected officials and civic leaders and even our neighbors who talk about housing as something that's only part of a free market, only part of economic or workforce development, when what it really is, like where we really need to start, is a recognition that we are talking about home and everything that means. If we aren't starting there, then we will absolutely miss the fact that housing instability is a cause of poverty and needs to be included in discussions about poverty. I just want to give an example of this, and just bear with me. so one way to think about this, sort of the spectrum of this problem and how housing instability can impact everything is talking about code enforcement, which is can seem really boring. Like, okay, code enforcement, great. But it's intricately related to the housing crisis. And without going into the weeds, I'm just going to tell a story that will illustrate it. When we were trying to pass the rental registration ordinance, the proactive inspection ordinance in Omaha, we took some city council members on a tour of a Palladino complex on 52nd and Northwest Radial. And on that tour, it was like the dead of winter, and a bunch of grown-ups crowded into this small apartment that smelled terribly. And we found out that it smelled terribly because there were dead things in the vents that were being allowed to rot away without anybody doing anything about them. We met in this apartment a 5-year-old girl, and I have a daughter now. I didn't have a daughter then, and now I have a daughter. So now I'm like even more livid about this than before. But there was this 5-year-old girl, and like, she was just a, you know, the perfect 5-year-old girl. She's just like thrilled that there's a new audience of people around that she can talk to and show off everything in her house to, and talk about her schoolwork and all of these things that, you know, are just really wonderful. And we're all trying to focus on her because behind her, as she's like performing, she's wearing a princess crown, there are cockroaches crawling down the wall behind her. And her parents were telling us about the fact that they had to put tape along the baseboards into her room because the complex was infested with bed bugs and had been infested for a long time. And they thought that the tape would catch the bed bugs before they went into her room. So she's in there showing us this while she's in her room, her parents are telling us about this tape, and she's in her room, and all she wants to do is show us her favorite thing in the world, which is her Moana blanket, right? And like, to have that like juxtaposed is just really upsetting. And they showed us all the steps that they had taken at great personal cost to try and get rid of the cockroach infestation that they told their landlord about and hadn't had anything done about. Their fridge was broken. They've been trying, you know, they had to pay extra for ice and coolers and all of these things. The cost they'd taken to stop mice from getting in the holes along the baseboard, the medical care they had to seek when the oven that went unfixed forever finally fritzed out and burned the mom, and no one came to fix it. And they couldn't call the city because it's not as if there are any better options out there for a family who both the parents worked in the meat packing industry. And because of these code violations, the 5-year-old had missed school. She'd missed field trips because of asthma and bed bugs. The parents had missed work to try to take care of this. They had spent money that they didn't have just to make their homes safe. And all of this is because we did not and do not have a proactive code enforcement system that would protect this little girl and her family. And the reason this family lives here and in this condition is not a choice. It is not because the free market dictates that if you can only pay this much in rent, then this is what you have to expect. It is because our housing policy is currently built on the idea that if you have less, you deserve less. And what happened to the people in this complex after we came in with the city is that they were moved out temporarily by their landlord so he could bring it up to code. He installed granite countertops and new wood floors and then made them sign a new lease that would make them pay more rent. So they had to find new housing. And I'm sorry, but I think it's absolutely unconscionable, and we should be ashamed of ourselves as a community, because we are not asking for granite countertops when we talk about housing equity and housing justice. We are asking for decency and compassion and a recognition of our shared humanity and the absolute necessity of a home because of that recognition. And it's no surprise, and I'm just going to keep going here, but I promise it's over. It is no surprise that the same neighborhoods that experience the most evictions, and further shocker that these are in majority non-white census tracts, also have the most code violations, the worst health outcomes, higher student turnover, lower performing schools, higher unemployment, less access to transportation, and now higher rates of COVID. And I have heard it said my entire life, usually from those who are attempting to make disparaging judgments about the poor, that everything starts at home. And that is true. So we should be fighting like hell to make sure that people have a home to start from. And so that's just like that's just me going off, but I mean, that's really what the housing crisis is talking about. We talk about like one facet of it, and it impacts people who are living in our communities, and it impacts their entire lives. So yeah, I'm not going to close that eloquently. So
I mean, I think you got some pretty good eloquent things in there. Decency, compassion, recognition of a shared humanity. Our housing system is built on the idea that if you have less, you deserve less. I think you got some eloquence in there. So thank you for that.
Put it on a bumper sticker. Let's go.
All right. So since we talked a little bit about food, and Together does work in food security space, I think I'd like to transition to Nancy for a little bit. Also, I think it's a nice segue talking about decency, compassion, recognition of a shared humanity. Nancy, you mentioned that you were involved in this work out of a belief in access to quality food. I hope that you could talk to us a little bit about the work that you do at No More Empty Pots and the approach that you all are taking to improve food security in our community and in our region.
Thank you, Tiffany. The work that we do at No More Empty Pots is around equitable access to healthy, nutritious food, education, employment, and entrepreneurship opportunities, because we do recognize that this is a system. It is not just a one-off thing. And when you're trying to address the issues of poverty, that it is interdependent upon other things. It's not just food, like people are food insecure because of other things. The same as housing. And housing is an integral part of this. When you think about Maslow's hierarchy, food and housing are on those bottom levels. And a lot of times people are forced to choose between having decent housing or having decent food. And unfortunately, with how many of us have learned to value food in this country, is that that's the thing that you can fudge a little, that you can spend more money other places, but cheap food is a way that you get by. The problem with that is that you may get some calories, but there is hidden cost in that. And a lot of folks that talk about regenerative agriculture and local foods and food security talk about true cost accounting. And what does it really cost to have food that on the shelf, it may look like a better value because it costs less. But in reality, there is a higher cost for it because the subsidy for that food getting to the shelf is not being realized because it's being covered outside of that. And the effects, the negative health effects of eating the food that may not cost as much, that has been processed and presented to certain people in certain areas, has a higher cost that is in healthcare and the lack of being able to live a healthful life that's free of disease and ailments. So if we really looked at what good food costs, it may have a higher dollar cost on the front side, but it is a better value long-term because of everything that goes into it. And so when we do our work at No More Empty Pots, you're trying to take into account the systematic arena of food and all the things that it's connected to, and trying to get as far upstream as we can to address the issue, but knowing that if you're hungry, you really don't care about much more else is going on until you get the hunger taken care of. And so we're trying to do the both and. We're trying to make sure that people have good access to healthy, nutritious, local food, while we're also trying to build the economic resilience of the community and farmers that are selling the food. And we're trying to make sure that people are exposed and can afford the food. And we're also trying to make sure that folks have access to opportunities so that they can earn more income and can transition from just getting the food to being able to choose the food. Because it's one thing to have someone give you something and say, this is the best thing for you. And another thing to have someone share with you, this is what I do for myself and the people that I care about. And I care about you and want to expose you to this so that you have this awareness and that now you have more opportunity to select this for yourself. And this is another way that you can further your ability to live the life that you want. And if you can't afford it, here are other opportunities to get to the point where you have more income and you can choose when and where you choose to eat this way.
You are doing a lot, Nancy. You are doing a lot. So can you talk to me a little bit about, you said, you know, this is a system, and interdependent. It's not just about food. Can you talk to us a little bit about, or help us understand, I have already learned from you the concept of food apartheid, and how that is differentiated from the concept of food deserts?
I forgot to unmute. I learned this in reading through some food security work. There's a lot of resources out there, but one thing that I have found odd since I started working in this area years ago is the lack of BIPOC in this circle. It's a really, really white area of work, when it seems that whenever you look at the dynamics and the statistics around who is most affected by food insecurity and poverty is people of color. So it's a strange dynamic to not have as many people of color working in an area that's mostly affected by people of color. And so as I've gotten deeper into this and learned, because honestly, I didn't get why there were so many people hungry, because we always had food, we grew our own food. And then I realized it's not because of food, it's because of politics. We waste 40% of the food that we produce in this country. So making more food is not going to solve the problem. And it's not going to solve the global problem of food insecurity. It's about having the right food in the right place and all the other systemic issues around who deserves to have what and when. The same thing that Erin mentioned about housing. And so when we start to dismantle all of these systems around the privilege of being able to choose and have things that are good for you, then we can address, we will also be addressing the issues around food justice. So I stopped using food security, food deserts, and started using food apartheid after reading about Karen Washington. And there's a link that I can share from her, an interview with her in The Guardian, where she talks about how there is systemic racism and inequality in the food system, just like in many other systems that we deal with on a daily basis, that affects having access to good quality food. And when you talk about a desert, Leah Penniman, who has a new book that came out last year, Farming While Black, also talks about this, where deserts are naturally occurring things that happen because of climate and how the evolution of time on landscape and topography and weather patterns. But apartheid is something that comes about because of systemic inequality. And we have the food system that we have that is primarily affecting people of color and food insecurity because of systemic inequality. It is not because of naturally occurring phenomenon. So that's why I now talk about it in terms of apartheid. And when we can start to address justice issues across the board and include food as part of this connectedness, then we can start to really get to the root issues of the food insecurity. So I now, whenever I have the opportunity to offer a new definition instead of food deserts, to offer food apartheid, and then engage in a conversation with people about that, so that it helps bring that anti-racist lens and view to the issue so that we can then get to what the real solution is and not keep having the Band-Aids around it.
Thank you, Nancy. I want to thank you for sharing that article. And it's the link to the Guardian article has been posted in the chat for our participants. So thank you, Nancy, and thanks for that important lifting up of that distinction and that systemic view of food justice and food security. I could talk to you all night. I'm going to have to move on. So one thing that you mentioned, Nancy, that I thought was a good segue to childcare was to talk about how families are forced to choose often between childcare between food and housing. I think another place where we see those choices play out and how it affects employment is childcare affordability, availability, quality. And so with that, I want to turn to Julia to talk a little bit about the challenges that are facing many families in childcare, but specifically the challenges that fall most squarely on the shoulders of low to moderate income families.
Sure. Yeah, so I think before I start talking about that particular issue, I want to make sure that we have kind of like a shared understanding of what we mean by affordable, and kind of the best measure, at least the best universal measure that we have is something that the U.S. Department of Health and Human Services came up with, which is that anything that costs more than 7% of your income is unaffordable. Under that, the department would consider affordable. And I think if you polled the average working parent, especially working mother, about how much their childcare costs as a percent of income, it would not be under 7%. So if we know that average childcare costs in Nebraska is about $11,000 to $12,000, what we also know is that only 6% of households in our entire state would be able to afford that average cost, looking at their household income. And I so appreciate that this conversation is holistically structured and includes all of these other issue areas, because I 100% agree with everything that's already been said, that there is a much larger systemic issue at play here. And childcare, like many other costs, particularly housing, healthcare, food, have significantly grown in the last few decades, while wage growth has not, and in some cases, especially for lower income folks, wages have fallen. So people are trying to do more with much less, and that falls the hardest on our single parents, and particularly our mothers and mothers of color, who are also facing all of these other compounding effects, a legacy of racism and sexism in the workplace, which all converges to where we are now in the pandemic. So last week, the latest jobs report found that 4 in 5 of the workers who left the labor force in our first month of the school year were women. 4 in 5 of them were women. And over a third of those women were Latina women. And I have some guesses about why we see that, because that is, those are some astounding numbers, and that's generally not how our economy has kind of recovered after a significant crisis like the pandemic. Usually women recover faster. And I think that childcare is the biggest issue here at play that is resulting in these disparities for women leaving the workforce. And I think one important distinction to make about childcare is that it's not that parents can't find work, it's that we don't value parents as workers and as caregivers. So parents are working, they are working whether or not they're getting paid for it. Caring for children is work. It's just not work that we pay and that we value in society. If you look at the average wage for a childcare worker, for example, who more often than not is also a parent themselves, and more often than not is a woman of color, that worker is paid $11 an hour and would not be able to afford the childcare that she is providing. And I think that balancing a caregiver and breadwinner role is difficult in any circumstance for any parent, especially during COVID, but it's impossible if you are a single parent or a low-income parent, or a parent who needs care on the weekends, after work hours, maybe if you don't know what your schedule is going to be like for the next week. That our economy was never built to support parents like this, and was never built to support women. And I think that if there's one silver lining in all of this chaos and devastation, it's that we can start to think about how we can build an economy where women are valued as workers and caregivers.
There is another bumper sticker in there somewhere. We don't value, it's not that parents can't find work, it's that we don't value the work that they're doing, something like that. Thank you, Julia. That was brilliant and beautiful. Can you talk a little bit about, Julia, I think there's a sense that, well, there's, programs that exist for families to help them with childcare. Can you talk about the policy levers that exist and their sufficiency or not?
Sure. So there's a couple of fairly large public investments in our childcare infrastructure, but what they all have in common is that they are significantly underfunded and only serve a tiny fraction of the kids that need those services. So Head Start, for example, serves roughly 1 in 2 eligible children, and Head Start is early care plus family support specifically for kids living in poverty. And early Head Start, which is for the younger kiddos, only serves about 5% of kids who would be eligible for those programs. The other big funding source out there is our Child Care and Development Block Grant, which is a federal grant that has also been significantly underfunded. And currently, the result of that is that we're serving fewer children than in the history of that block grant. So in the state of Nebraska, we know that only about 1 in 4 children who would be eligible actually receive the subsidy. And it is actually much lower for Latinx and Asian children. So there's definitely some disparity for children of color in that program as well. And I think the crux of the problem for these two primary funding sources is that they are not tied to need or to changing demographics. They are tied to, they are at the mercy of political will. So every few years, Congress decides to throw some more money at the problem, but by then it's been so significantly underinvested that there's just not an infrastructure for us to really even work with. And I think that, childcare was kind of in a crisis mode before the pandemic, but I think we're fully in a catastrophe now when it comes to our childcare infrastructure, and it's hard to see a way out at this point.
Thank you, Julia. So last but certainly not least, we'll turn to Brenda Council to help us discuss reproductive justice. So Brenda, if you could talk to us about reproductive justice and how it differs from terms like reproductive rights and reproductive health, which is often used interchangeably, but incorrectly so. So if you could help us break that down a little bit.
Thank you very much, Tiffany. And I appreciate all the comments from the other panelists thus far, because a lot of the impacts and the effects of reproductive justice are represented in the issues that they're facing: food insecurity, housing, childcare. And the thing about reproductive justice is it includes both reproductive rights and social justice. And I'm wearing my social justice t-shirt this evening, because when we think about reproductive justice, we think about what it means, and understanding that African-American women coined the term reproductive justice, because looking at the impacts on poverty. And when I looked at what was going on in Douglas County, Nebraska, let me share it with you. One of the concerns that I was presented with was that 60%, over 60% of African-American children in Douglas County were born to single women. And that 75% of children under age 5 in Douglas County lived in poverty. So there's clearly a link between unintended pregnancies and poverty in this county. Yet we weren't doing anything to address access to reproductive health care. We weren't doing anything to address access to comprehensive sex education, to try to place women in a position that they can control their lives. So if you think about what reproductive justice means, reproductive justice talks about body autonomy and the ability to decide whether to have children, when to have children, and if you have children, to raise those children in safe and secure communities, right? So which gets to the food insecurity issues, which gets to the child care issues, which gets to the housing issues. And so if we don't deal with access to reproductive services and resources, we're just going to continue to compound these problems. And that's one of the reasons why I was so grateful to be in a position to join the Women's Fund and to lead the Adolescent Health Project, because our objectives were, number one, to increase access to comprehensive sex education. Let's talk irony. In 1986, I was on the Omaha Board of Education. And in 1986, I pushed for comprehensive sex education at OPS. When I joined the Women's Fund in 2014, they had not performed an update of that sex education program since 1986. So here we are, you know, years and years later, young people are not getting accurate information, right? And we're seeing our unintended pregnancy rates escalating. We're seeing our poverty rates escalating because there's a definite connection between poverty rates and unintended pregnancies in this county. So if we don't have access, and that's the whole thing about reproductive justice. Don't confuse, reproductive rights has to do with your right to access services. Reproductive justice is your ability to access those services. And that's where the disconnect is that we're not able to access those services. And so the Adolescent Health Project, one of the components of it was access to free contraceptive services, so that no one would be denied the ability to control, in the terms of reproductive justice, when they had children and whether they had children. And we get so tied up because people want to confuse and say that reproductive justice is all about abortion. No, abortion is a part of it, but reproductive justice is about access to reproductive services, which includes abortion and the right to have that. So if you look at how we can begin to address some of these issues of housing, of childcare, we have to get to the fundamental right of body autonomy and the fundamental right to decide whether I have kids, when I have kids, and whether I can raise those kids in a safe and secure environment.
Can I get an amen from anybody? Okay. So we need the participants to start adding some questions in the Q&A, or else I am just going to monopolize the rest of the 15 minutes and ask these incredible people more questions. So please put some questions in the Q&A, but I do want to give one more to Brenda before I turn it over to others and let go of the mic. Brenda, as a former elected official at both the state and local level and a fierce advocate for racial and gender justice, what advice can you give to all of us as we advocate for reproductive health, reproductive rights, and social justice in Nebraska?
And you just said it there, Tiffany. We have to continue to advocate. I mean, policy changes have to be made. When I think about food insecurity, when I was in the Nebraska legislature, it was clear that there were communities across this state that were experiencing food insecurity, and we use the term food deserts. And we had an opportunity to enact some legislation that would enable these communities to add access to these food, and able to get it passed through the legislature, and it was vetoed. And when you think about that, you go, well, you know, why would you veto that? I mean, think about where we live. We live in Nebraska, where the primary economic driver is agriculture. We ought to have food to school programs where we're connecting the producers of food in our state to the people who need food in our state. Yet we don't enact those policies to make that happen. The same holds true with reproductive justice. You know, when we think about access to contraceptives, if we provide access, free and open access to contraceptives, you know, women can choose when they have children and how they have children, and whether or not they're in a position to take care of those children.
Thank you, Brenda. Okay, so unfortunately, some of our participants have submitted brilliant questions, so I'm going to turn it over. Kelsey Waldron, our policy research associate at the Women's Fund, has been navigating the questions, so I'm going to let her pose the questions.
Thank you, Tiffany. We had one question for all panelists, and I'm sure that there's a multitude of answers for this, but the question is, if you each had a magic wand specifically for what would fix what ails Omaha, what would you do first?
I have so many inappropriate answers to this. But I think I'm just gonna jump in. I think in housing, I would put an immediate stop to annexation, and I would devote significantly more significantly more resources, the little resources we have to encourage the development of housing. I would direct them entirely to creating more density and more equitable distribution of safe, affordable housing throughout the city. And I'll get secede from West Omaha shirts for everyone. I'm just kidding. I grew up there. I can't say that.
Yeah, you know, for me, it would be economic investment in communities that have been neglected for decades. When I look at North Omaha and I think of the economy that existed when I was a kid that no longer exists, and I see the evidence of not just benign neglect, but intentional neglect. We have to invest in these communities, and that's what I want to see. These dollars, when we talk about tax increment financing, people have to understand that tax increment financing was developed as a means to invest in communities that had been ignored. And what we see is those resources being used to create opportunities in communities that haven't been ignored and can provide this kind of development without relying on these resources. So we need to get back to the point where we use these tools to benefit the communities that they were designed to benefit.
Brenda just brought up my favorite topic for anyone who follows my Twitter.
I was going to say we've got annexation and TIF. What else?
TIF. I can't even.
But yeah. I'm into it. I
just want to like re-emphasize. I'm sorry, what Brenda said, because it's so important. Is like the reason we have the problems we have in Omaha is because we intentionally created those policies in the past, and now we act like if we just ignored these policies that they'll fix themselves. And we need to address these issues with the same intentionality now that we had when we developed them to disenfranchise and marginalize these same populations. And if we're not going to address them with that same level of intentionality, then we're not doing anything at all, honestly.
Yes, and I agree with all that they've said. The thing that for years, because I'm a transplant to Omaha, but for years I didn't understand why things were the way they were, and I have a better insight into that now. But the one word that I still stick to when I think about Omaha is potential. It is one of the few places in this country where we have this dichotomy of we have the most millionaires per capita, but we also have a high level of poverty for people of color. That's not something that just happens. It is intentional. And like Erin said, and Brenda said, that it is where the distribution of the available funds are going. It's not about whether there's enough to go around. There is plenty. We just have to have the people who make those decisions either spread that decision making out, so more people that are affected by this actually get to help make the decisions on where those funds are being distributed, so that the people who are in it are trusted to have a solution to, and then the funds to help implement those solutions and some guidance and support. But the other thing is we also need to have the actual will to do it, because there is nothing stopping us from being this model community of equity, but we're just choosing not to do it. We have all the other resources here.
I am going to try to stick to childcare, and I think that most of my work is at the state level, but this would definitely have an impact on Omaha. I would, if I could wave a wand, I would increase the eligibility level for childcare, so that as long as you don't earn a living wage to make ends meet, you are eligible for childcare assistance. And I think what Nancy said is on the nose for almost anything that we can talk about when it comes to this issue. That the money is there, but the will isn't. And I think the child care program is the best example of that, because in 2002, then Governor Johans line item vetoed this program. And with the promise that someday in better times, we would restore this program. And 18 years later, it still has not been restored. And somehow at the end of this legislative session, senators were able to conjure up hundreds of millions of dollars to give away to corporations, and still didn't fulfill their promise to working parents to make sure that people don't have to choose between getting a raise or working a few extra hours and being able to make ends meet. Yes, I think that would make a huge difference for a lot of families right now who are trying to decide if they want to get an extra $80 a month or if they want to keep their subsidy for $400. And every year that we decide not to do that is another year that parents are forced to leave the workforce.
And Julia, add to that, during this pandemic, when, for example, the largest school district in Omaha decided not to have in-person education, and children were going to have to stay at home. And a lot of these parents, low-income parents who had to work and rely on childcare, yet the Department of Health and Human Services would not provide those childcare providers with Title 20 benefits because of their regulations that said, well, they're supposed to be in school. Well, you couldn't do it. I mean, there was no flexibility. There was no effort made on the part of state government to make it possible for parents to have their children in safe and secure environments, accessing education, while their parents many of whom were the most essential workers in our community, right? But yet we weren't in a position to change those policies to enable parents to continue to work, enable their children to be in safe and secure learning environments. These are the kind of policies that we need to change.
Another amen. So there was one question that was asked, can we go another hour? And I wish that were true, but we cannot. So I wonder if we could close on the question that I had asked you all to think about in closing. You know, given your issue area or what you've talked about, what is the most important question that you would ask candidates for elected office? What would you tell us to make sure we are asking folks as we consider them to create the policies that we're talking about and make the kinds of choices that we need them to make? What sort of questions would you suggest we're asking of folks running for office?
Well, Tiffany, I'll go ahead and go first, because I'm going to ask any person who's running for elective office, whether it's local, state, or federal, what are you going to do to ensure that women have access to reproductive services? And that means contraceptive care, that means access. I mean, when I look at this state of Nebraska, how many people know that African-American women in the state of Nebraska have a higher risk of maternal mortality as well as infant mortality than any people in any other place in the country? So what are you going to do to ensure that women in this state have access to reproductive services?
I'll go next. It has nothing to do with the brilliance of Brenda Council. But, I would specifically ask, what specific policies are you going to enact that will decrease evictions in this state? And I've ranted about this before, but I think that you have to demand nuance of candidates in this question, because saying that you support more affordable housing is not enough. It's not clear enough. It ends up with $10 million into rural workforce housing, which we did this session, instead of stopping evictions in the midst of an unprecedented global health crisis. So what specific policies are you going to enact, or are you going to support and push for and fight for, that will decrease evictions in the state? And I also generally want to know, do you believe there is such a thing as the undeserving poor? Because that is how so much of our legislatures act. Like, the way that, being poor means that you deserve less. Having less means that you deserve less. And that is absolutely not true. It is unconscionable, and it is a bad faith place to start a public policy debate. So those are the two things that I would ask. Got a whole other list of questions, but that's where I'd start.
Now, I'm not even religious, and I'm going to give another amen. Anybody else? Anybody else? Nancy, do you have a closing question? Closing for folks?
Julia just unmuted, so go, Julia.
I just like to fill awkward silences, so I thought I would start talking before, and maybe an idea would come into my head. I think I would specific to childcare, I would ask candidates, what specific policies are you going to enact to ensure that every parent who needs childcare can afford it? And I think Erin's point about nuance is so important here. I want a full listing of every discrete policy. And it's okay sometimes to not have the answer. So if they don't have the answer, I want to know who they're going to ask and who they're going to listen to, because this is an unsustainable situation for parents right now. It really is. So
I love that. Who are they going to ask? Who are they going to listen to? It's really important, Julia.
I agree with all those. And I'd like to ask people, what are they afraid of? What brings them fear? Because if I know that, it helps me cut to the chase of the next questions to ask, because then I can go, the policies or after you get to what they are afraid of and their values are. Their fears help you understand why they do the things they do, and then you can help get to hopefully helping them be open to another side if they're vulnerable and open enough to share what they're afraid of with you.
I love that. Well, I hope all of the participants will share and join with me in raising a glass to our incredible panelists. I am so grateful for your time and expertise. We posted in the chat links to these brilliant women's organizations. We think it's incredibly important to support their work, and so we've lifted or provided links in the chat. I cannot thank you enough for helping us have this important conversation about broadening what advocacy should look like on behalf of all women in our community, not just some women. And so I am so grateful for your time and expertise, and honored to get to work alongside you. So thank you. For all our participants, this recording will be on our website tomorrow. We really want to thank you for the sold out showing and for your grace as we navigate this virtual Zoom world. So thank you.
Thank you for having me.
Sure. Bye, everyone. Thank you.
Thank you. Cheers. Bye.
Cheers.